Hi, I'm Aurel Enriquez, and this video contains our discussion on Chapter 17 of Mahon's textbook of Diagnostic Microbiology, which talks about the clinically significant Neisseria species plus Moraxella catarrhalis. Here is the outline of our discussion. As usual, let's first look into the general characteristics of Neisseria species. Then let's talk about the primary pathogens. After that, we'll look into Moraxella catarrhalis, which is a very similar organism. And lastly, we'll just quickly go through the commensal Neisseria species. Let's begin with the general characteristics of Neisseria and the pathogenic Neisseria species. Neisseria species are obligate aerobes. They are non-motile, non-spore forming, and capnophilic bacteria. They are carbohydrate fermenters, and depending on which species is being tested, nag-iiba-iba din po yung results nila in the carbohydrate fermentation test. And this could help us differentiate one species from another. They are also positive for both catalase and oxidase. They are easily killed by heating or drying or just being in an environment that is not favorable for their growth, which is why it is recommended that direct inoculation of specimens be done at the patient's bedside or parang on the spot, no? Agad-agad po pagka-collect ng sample, dapat meron na rin kayong culture or transport media on hand because any delays in plating the sample might lead to it drying out and subsequently hindi nyo na rin sila mag-grow in culture because they're dead. So, in gram staining, all Neisseria species are gram-negative cocci except for Neisseria elongata, Bacilliformis, and Waveri. So, these three are shaped like bacilli or rods. Now, in the following slides, we'll further discuss Neisseria gonorrhoeae and Neisseria meningitidis because they are the primary human pathogens. Onto these specific species, first up is Neisseria gonorrhoeae. This is not in any case a part of the normal flora of humans, but humans are its only known host. So never po naging part ng normal flora ang Neisseria gonorrhoeae for humans, but this bacteria has only been documented to infect humans. Neisseria gonorrhoeae is a leading cause of sexually transmitted infections, but this may also be acquired through vertical transmission, where an infected mother passes on the pathogen to their newborn during birth, specifically through normal delivery, where the baby has to pass through the vagina or the birth canal. Its primary virulence factor is its pili, which helps it attach or adhere to host cell surfaces more effectively. So, as we can see right here, listed here are all the other virulence factors of Neisseria gonorrhoeae. It also has receptors for human transferrin. Um, Protein 2 or OPA is for adherence to phagocytic and epithelial cells. So maliban sa pili or fimbriae, that's also for adherence, no, it also has the protein 2. Next, protein 3 would block serum IgG, and IgA protease would cleave IgA on mucosal surfaces. So may dalawa naman siyang virulence factor that is against immunoglobulins. Okay, so tatandaan po natin protein 3 is against IgG and the IgA protease is against IgA. No? So it would kind of like modify the structure or yun nga po, no, cleave the structure of IgA. Next is the LOS endotoxins. All right. So LOS endotoxins mainly help with antigenic variation. So, Neisseria gonorrhoeae has different strains that can produce different colonial types. Okay, so ulitin po natin, no? May iba't ibang strains po ang Neisseria gonorrhoeae and maaaring mag-iba din po yung appearance ng colonies na kaya nilang i-produce. So, types T1 and T2 are the virulent strains because they have villi. So, they're equipped with villi and they usually produce small raised colonies. Meanwhile, types T3, 4, and 5 are avirulent dahil wala po silang pilay. Okay? So again, um, let's repeat. The primary virulence factor of Neisseria gonorrhoeae is its pilay. So if they don't have the pili, then we would refer to them as avirulent. So as we can see right here, they don't have pili and they're capable of producing large flat colonies. Okay. Gonorrhea is an acute pyogenic infection, which means it's pus forming. It has been historically referred to as flow of seed, as the purulent urethral discharge that was observed to come out of the male urethra was mistaken for semen. So in Filipino, this is known as tulo. Gonorrhea is sometimes also known as the clap from the French word clapois, meaning brothel, correlating this with the fact that this is a sexually transmitted disease because brothels include establishments that offer sex worker services. Gonorrhea is mainly transmitted through sexual contact, and listed here are the primary sites of infection. So, gonorrhea has a short incubation period of approximately 2 to 7 days. And in men, acute urethritis would result in purulent discharge and dysuria. So, when we say dysuria, it means painful urination. Asymptomatic gonococcal infection in men is uncommon, but up to 10% of cases have been found to be asymptomatic. However, in females, mas mataas po yung cases of asymptomatic infections. 50% of cases in women may be asymptomatic, leading to complications. So on the next slide, tignan po natin ano ba yung mga possible complications of gonorrhea. Listed here are the clinical symptoms and complications of gonorrhea in both men and women. In men, complications of purulent urethritis includes prostatitis, which is an infection in the prostate, and epididymitis, which is an infection on the epididymis or the tubes located behind the testicles. In about 10% of cases, some men could have asymptomatic infections where the common isolate seems to be the Neisseria gonorrhoeae AHU strains. AHU stands for their nutritional requirements, which are arginine, hypoxanthine, and uracil. Okay. Now, in women, asymptomatic and undiagnosed infections could lead to complications such as pelvic inflammatory disease. So the pelvic inflammatory disease, or PID, is an infection of the female reproductive organs, specifically those located at the pelvis. Basically, since the infection was left untreated because the patient was asymptomatic, ano pong nangyayari when the patient is asymptomatic? Wala, 'di ba po? Wala silang nararamdaman, so hindi sila magpapa-check up at hindi rin sila magagamot. So the infection spreads upward starting from the urethra until it reaches all the other reproductive organs. So that's located at the pelvis. So again, that's what happens in cases of PID. Okay. Next, another complication is the Fitzhugh-Curtis syndrome. The Fitzhugh-Curtis syndrome is a complication of pelvic inflammatory disease where inflammation now spreads to the liver capsule. So the liver capsule is a thin, fibrous connective tissue that encloses the liver. Basically, pataas lang po ng pataas yung spread ng infection. Simula sa urethra, papunta dun sa female reproductive organs at the pelvis and aangat hanggang sa andun na nga po sa liver capsule. All right, so that's for the Fitzhugh-Curtis syndrome. It's spread of the infection up to the liver capsule. Bloodborne dissemination of Neisseria gonorrhoeae occurs in less than 1% of all infections, resulting in purulent arthritis and rarely septicemia. Other conditions associated with Neisseria gonorrhoeae include anorectal and oropharyngeal infections. Now, infections in these sites are more often common in men who have sex with men, but also could occur in women. Newborns can acquire Ophthalmia neonatorum, a gonococcal eye infection during vaginal delivery through an infected birth canal. Since yung bacterial cells daw po ay nasa birth canal nung infected mother, what happens here is that when the baby passes through, yung ibang bacterial cells po kumakapit sa mucous membranes on the baby's eyes, leading to this eye infection. So recall time, what is the primary virulence factor of Neisseria gonorrhoeae? It's their adhesive pili, di ba po? So, using these adhesive pili, they attach to the mucous membranes of the eyes as the baby passes through. So, ophthalmia neonatorum can result in blindness if not treated immediately. This infection is treated with oral erythromycin for about 14 days. Topical treatment alone is not going to be effective, so topical erythromycin ointment may be beneficial as an adjunctive therapy. In the past, 1% silver nitrate eye drops had been used as a prophylaxis. So they administer these eye drops even before the infection develops if they know that the mother is in fact diagnosed with Neisseria gonorrhoeae infection. But again, this has been replaced with erythromycin. The specimen of choice for genital infections in men is from the urethra, and in women, it's from the endocervix. In men, purulent discharge can be collected directly onto a swab for culture, but when no apparent discharge is present, the swab is inserted up to 2 centimeters into the anterior urethra and slowly rotated to collect material, as shown here in this pop up illustration. Calcium alginate and cotton swabs are inhibitory to Neisseria gonorrhoeae, so Dacron and rayon swabs are preferred. Now, because Neisseria gonorrhoeae is extremely susceptible to drying and temperature changes, direct plating of the specimen to gonococcal selective media gives optimal results. So, shown here, all right, shown here is the Gembex system. This system contains selective agar and carbon dioxide generating tablets. So the Gembex system stands for the James E. Martin Environmental Chamber, and an example of that is shown here on the photo to the bottom right. So yung bilog na space po dun sa gilid, dyan po pwedeng maglagay ng CO2 tablets for these capnophilic organisms. Now, for gram staining naman po, gram stain is not recommended for pharyngeal specimens because commensal Neisseria species can be present. Now, the demonstration of gram negative intracellular diplococci from the urethral discharge is evidence of gonococcal infection. The gonococci in pairs with adjacent sides flattened give them a kidney bean or coffee bean shaped appearance. So this photo to the left is what Neisseria gonorrhoeae would look like upon gram staining and microscopy. So listed here are all its other incubation requirements. So its optimum growth temperature is at 35 to 37 degrees Celsius. The duration of incubation is up to 72 hours. So you keep the plates for up to 72 hours before reporting as negative. And again, make sure to provide a capnophilic environment. The medium of choice for cultivation of Neisseria gonorrhoeae is the chocolate agar. So typically, Neisseria gonorrhoeae will not grow on BAP or SBA. But because the chocolate agar also supports the growth of many other organisms found as commensals in the specimens collected for the recovery of gonococci, a selective medium is necessary. So, isa-isahin po natin itong mga culture media na ito. First up is the Thyre-Martin agar. So the Thyre-Martin agar is composed of a chocolate agar base with the addition of Isovitalex. So Isovitalex is basically a commercially formulated supplement for fastidious organisms such as Neisseria. Aside from that, it also contains VCN. No, VCN. It means that it has vancomycin, colistin, and nystatin. So ano ba ang purpose ng mga ito? Okay, so these are the selective components. All right, so vancomycin work against gram-positive organisms. So it prevents the growth of gram-positive organisms. Next, colistin would prevent the growth of gram-negative organisms, and nystatin would prevent the growth of commensal fungi or yeast organisms. Okay, so lahat po ng components na ito ay para maiwasan yung growth ng mga normal flora that's present from the patient sample. Next is the modified Thyre-Martin agar, which contains the exact same components as the Thyre-Martin agar, but with the addition of trimethoprim lactate. So what's the purpose of trimethoprim lactate? It should prevent the swarming of Proteus species. Okay, so Proteus species has been very well known to produce swarming colonies. Now, the problem with that is that this could possibly kind of like cause an overlap between the colonies of Neisseria gonorrhoeae and the colonies of Proteus. So in the event na hindi natin totally ma-eliminate or ma-prevent ang growth ng Proteus species, we could at least prevent their swarming. Para po, meron pa rin tayong isolated colonies ng Neisseria. Next is the Martin Lewis medium, okay, which again is basically the same as the modified Thyre-Martin agar, except nystatin has been substituted with anisomycin. But again, the purpose is the same. It's also to prevent the growth of yeast contaminants. Okay? So ayun po no, yung mga um yung mga different selective media that could be used for the isolation of Neisseria, it's basically one big pakopya ng assignment mo, papalitan ko lang ng konti, di ba? Parang the base is the same, but they're just switching up some of the inhibitory components or they're just adding things, di ba po? Up next is the New York City medium. Now, this one is a transparent medium, which has a different component. So it now is composed of lysed horse blood plus yeast dialysate. So imbis na chocolate agar at isovitalex, no? Chocolate agar pa rin siya, but it is now composed of horse blood and yeast dialysate as the additional nutrient source. Okay? So inhibitory components would include vancomycin, colistin, and trimethoprim, which again, vancomycin would prevent the growth of gram-positive organisms. Colistin would prevent the growth of gram-negative organisms. Trimethoprim would prevent the swarming of Proteus, and amphotericin B. So amphotericin B would also prevent the growth of yeast organisms. So kumbaga ni-level up na po nila yung antifungal that's present in the New York City medium. Now, for this one, ang New York City medium po could also be used to grow genital mycoplasma. Last on the list is the G Select medium. So the G Select medium is exactly the same as the NYC medium, except with the addition of lincomycin. So lincomycin is also capable of preventing or inhibiting the growth of gram-positive organisms. The traditional method for the identification of Neisseria species was carbohydrate utilization in cysteine trypticase agar or CTA, which would contain 1% of the individual carbohydrates and phenol red as a pH indicator. So each tube of CTA now would contain either 1% glucose, 1% maltose, or 1% sucrose, or 1% lactose. So, if the organism uses the given carbohydrate, acid production would happen, and that is indicated by a yellow color that is observed within 24 to 72 hours. So, as we can see in this picture, ang Neisseria gonorrhoeae po ay nagpa-positive for glucose only, while Neisseria meningitidis will be positive for both glucose and maltose. All right, so that was for the carbohydrate utilization test. The oxidase test can be done on all suspected isolates of Neisseria gonorrhoeae. So on a filter paper, all right, using the filter paper method as shown here, the oxidase reagent, which is 1% dimethyl paraphenylene diamine dihydrochloride, or tetramethyl paraphenylene diamine dihydrochloride is placed on the filter paper, and a colony from the plate is rubbed onto the reagent with an applicator stick. So, a positive result is indicated by a purple color that develops within 10 seconds. Alternatively, the oxidase reagent may simply be dropped directly onto a colony, and a positive reaction, the colony turns deep purple, as we can see right here in these examples. So that was for the oxidase test. Similar to Neisseria gonorrhoeae, Neisseria meningitidis is also only found in humans. However, Neisseria meningitidis can be found as a commensal. So, Neisseria meningitidis can be found on the mucosal surfaces of the nasopharynx and oropharynx in about 30% of the population. So, this is an important etiologic agent of endemic and epidemic meningitis and meningococcemia. They have the same microscopic morphology as Neisseria gonorrhoeae. They have the same virulence factors, but if we were to do carbohydrate utilization tests, Neisseria meningitidis will ferment both glucose and maltose. And here's what they look like on BAP and on CAP. After exposure to the meningococcus, the incubation period ranges from 1 to 10 days. The bacteria adheres to the nasopharyngeal mucosa, leading to colonization. Now, in most individuals, colonization of the mucosa results in a subclinical infection or just mild symptoms. In a few hosts, the bacteria gains access to the bloodstream and potentially the central nervous system, resulting in meningitis, sepsis, or both. So, meningococcemia or sepsis may occur with or without meningitis. Okay, so hindi po porket may meningo dun sa pangalan ng meningococcemia ay automatically may meningitis na ang pasyente. Okay, it doesn't work like that. All right, so symptoms of meningococcemia includes purpura or hemorrhaging of blood into the skin and mucous membranes, producing bruises, as we can see right here on this photo. There's also petechial skin rash or pinpoint red spots caused by hemorrhage, as we can see. Okay, so in some cases, the disease becomes fulminant and spreads rapidly, causing DIC or disseminated intravascular coagulation, plus septic shock and hemorrhage of the adrenal glands, which is referred to as the Waterhouse Friderichsen syndrome. All right, ulitin po natin, no? If there is already hemorrhage of the adrenal glands, then this is now referred to as the Waterhouse Friderichsen syndrome. And the specific virulence factor that's responsible for this is the LOS endotoxin. Let's move on to Moraxella catarrhalis. Moraxella catarrhalis is isolated only from humans as a normal flora of the nasopharynx, so it's only recognized as an opportunistic pathogen. It has been documented to cause upper respiratory tract infections, otitis media, and sinusitis. Moraxella catarrhalis was formerly known as Branhamella catarrhalis, and listed here are the acceptable specimen sources. And of course, you have to correlate. You have to correlate that with the clinical manifestations. So, if for example, sinusitis po yung case ng pasyente, then you have to collect nasopharyngeal samples. But if it's a case of otitis media or middle ear infection, then that's when you would collect ear effusions. The presence of intracellular gram-negative diplococci in respiratory samples may possibly give us an idea that the infection is caused by Moraxella catarrhalis. So that's one of their similarities. No? So parehas pong gram-negative diplococci ang Neisseria and Moraxella. Other similarities between Neisseria species and Moraxella catarrhalis is that they are both oxidase and catalase positive, but here's what's different. Moraxella catarrhalis is usually inhibited on gonococcal selective agars that contain colistin. Okay? Next, Moraxella catarrhalis is a saccharolytic, meaning it cannot ferment any carbohydrates and will give a negative result on the carbohydrate fermentation test. So recall time po, which carbohydrate does Neisseria gonorrhoeae ferment? Glucose. All right, Neisseria gonorrhoeae ferments glucose. Next, which carbohydrates do Neisseria meningitidis ferment? Glucose and maltose. All right, so Neisseria meningitidis ferments glucose and maltose. So now keep in mind, which carbohydrate does Moraxella catarrhalis ferment? Wala, none, 'di ba? Because again, Moraxella catarrhalis is asaccharolithic. Another difference is in the DNA's test. Okay, so ang Moraxella catarrhalis po ay DNA's positive, but Neisseria species are DNA's negative. Moraxella catarrhalis can grow on BAP and CAP, producing smooth, opaque, gray to white colonies. Now, the term hockey puck has been used to describe the colonies because it remains intact when pushed across the plate with a loop, as we can see right here in this GIF. Now, older colonies may give a wagon wheel appearance, as we can see right here in figure B. On to the last segment of our discussion. Let's now talk about the commensal Neisseria species. Commensal Neisseria species have been divided into three groups. So, group one contains the traditional pathogens, which we've already discussed, Neisseria gonorrhoeae and Neisseria meningitidis. Group two contains the commensal species that could grow on selective media, and they're also further divided into saccharolytic and asaccharolytic organisms. So, as we can see right here on this list, no, group 2, asaccharolithic po ang Moraxella catarrhalis. Next, group 3 would include the commensal species but would produce no growth on selective media. And same with group 2, they have been divided between the saccharolytic and asaccharolytic Neisseria species. So for further information and other biochemical tests that we could perform on these commensal Neisseria species, you could check table 17.8 of Mahon 7th edition. Neisseria cinerea has received considerable attention in the recent years because of its misidentification as Neisseria gonorrhoeae in some commercial identification systems. So, although Neisseria cinerea is glucose negative in CTA sugars, the glucose was interpreted as positive in some commercial kits, making it biochemically identical to Neisseria gonorrhoeae. The colony morphology of Neisseria cinerea is also similar to the T3 colonies of Neisseria gonorrhoeae on chocolate agar. Although, here's the difference. Neisseria cinerea grows on SBA, whereas Neisseria gonorrhoeae cannot grow on SBA. Next, Neisseria lactamica can be misidentified as Neisseria meningitidis because of its similar colony morphology, although Neisseria lactamica is slightly smaller and its ability to grow on selective media. Although Neisseria lactamica also utilizes glucose and maltose, it could also utilize lactose. No? So it's quite easy to remember kasi nasa pangalan na niya yung additional carbohydrate that it could utilize. So, Neisseria lactamica could metabolize lactose. And the thing here is that sometimes it could exhibit delayed lactose utilization. That's why it could be confused with Neisseria meningitidis. Colonies of Neisseria mucosa are large and often adherent to the agar, and they're very mucoid. That's why it was named mucosa. So, Neisseria mucosa is usually isolated as a non pathogen from the nasopharynx of children or young adults. However, this organism has been documented to cause pneumonia in children. The colonies of Neisseria sicca are usually dry, wrinkled, adherent, and breadcrumb like in appearance. So, the Latin word sicca actually means dry, and research has indicated that it should be a variant of Neisseria mucosa, right? Next is Neisseria subflava. So the species name for Neisseria subflava actually means less yellow. So the organism is considered part of the upper respiratory microbiota. Although it is considered as a non-pathogen, it has been reported to cause serious infections such as bacteremia, meningitis, and septicemia. Its clinical description may resemble a Neisseria meningitidis infection, including septic shock and petechial hemorrhage and purpura. Next is Neisseria elongata, Waveri, and Bacilliformis. So again, these three are unique among the other members of the genus because they are rod or bacilli shape. Okay, ulitin po natin. Halos lahat ng Neisseria species ay gram-negative diplococci, di ba po? Pero ang Neisseria elongata, Waveri, and Bacilliformis, they are gram-negative bacilli or gram-negative rods. All right. So the catalase test for this group of subspecies is negative or weakly positive compared to the other Neisseria species. Neisseria elongata is a commensal in the upper respiratory tract and are considered as opportunistic pathogens. Now, several cases linking Neisseria elongata to endocarditis has also been reported. Neisseria waveri is a normal oral microbiota in dogs and can be found in humans in infections following dog bites. Okay, so Neisseria waveri is catalase positive and does not produce acid from any of the carbohydrates. Rare cases of septicemia in immunocompromised patients have been reported to be caused by Neisseria waveri. So again, ulitin po natin, normal flora po talaga ito ng mga aso. Okay? So it's only transmitted to humans in cases of dog bites. Here are the references that were used in the making of this discussion. That ends our discussion on chapter 17 of Mahon's textbook of Diagnostic Microbiology, which talks about the clinically significant Neisseria species plus Moraxella catarrhalis. This has been Aurel Enriquez. Thank you so much for watching.